First aid is an important aspect of daily life. It refers to the initial or first action that everybody should do in an emergency. In other words, it is a first aid to an injured person while waiting for the arrival of medical official or before being sent to the nearest clinic or hospital. It may be able to help improve the victim's condition or be able to heal and treat the pain. However, first aid should not be a substitute for actual medical care. It is only a help that can be given while the real help arrives. First aid kits should contain some essential equipment to use during an emergency. It usually contains adhesive plaster, elastic bandage, triangular bandage, clinical thermometer, scissors, safety clips or pins, medications such as antiseptic lotion, and many more. There are various dangers and injuries that may happen in a house, such as burns, bites and stings of insects, choking, poisoning, bleeding, electric shock, faint, and so on.
Types of wound. Wound can be classified in a number of ways depending on the time of healing. People may experience various types of injuries throughout their life while performing daily activities. Depending on the cause, size, and depth, wound can range from mild to severe. Here, I will describe a few different types of wound. Wound can be open or closed. Open wound are the wound with exposed underlying tissue or organ and open to the outside environment. On the other hand, closed wound are the wound that occur without any exposure to the underlying tissue and organ. Next, acute or chronic wound can be classified depending on the healing time. Acute wounds are those that heal without any complication in a predicted amount of time, while chronic wounds, on the other hand, are those that takes a relatively long time to heal with some complication like pressure injuries or diabetic ulcer. Besides, clean or contaminated wounds. Clean wounds are those that do not have any foreign material or debris inside, whereas contaminated wounds or infected wounds are those that might have some dirt and bacteria. Lastly, wound can be also internal or external. Internal wound can be due to the impaired circulation, nervous system function, neuropathy, or medical illness, while the external wound can be due to and outside forces or trauma caused by penetrating object or non-penetrating trauma. Each type of wound has a different approach and method of treatment. Minor wound can be treated by a regular medical practitioner, but if you see any sign of infection, you need to call or go directly to hospital.
There are plenty number of treatments depending on different types of injuries. In this video, I will be focusing on two common accidents in the home and ways to treat them. The first one will be burns and scalds. Well, there are three types of burns, and in this video, I will explain about the treatment procedure for first-degree burns. The first step is to stop the burning process immediately. The second step is to remove any clothing or jewelry near the burnt area of skin. The third step is to cool the burn with cool running water for 20 minutes as soon as possible after the injury. Most importantly, never ever use ice, iced water, lotions or ointment. The fourth and final step is to cover the burn area with sterile, non-adhesive bandage or clean cloth. The second one will be wound bleeding. The first step is to stop the bleeding. It is done by removing any clothing or debris on the wound. The second step is to clean the cut or the wound. Press the bandage firmly with your palm to control the bleeding. The third and final step is to protect the wound. Antibiotic cream or antiseptic is applied to reduce risk of infection and covered with a sterile and clean bandage. Change the bandage daily to keep the wound clean and dry.
Items contained in first aid kit are different depending on situation, place, and also company that market the first aid kit. For example, if you want to go to camping, we may have specific checklist on which thing we want to bring to our campsite that we may use if there is an emergency. For home, we may have basic tool in our first aid kit, and we also add some medicine, which is the over-counter medicine, which we can take without any prescription by the doctors or pharmacists. For example, Panadol or Hurix for coughing. And if you buy the first aid kit from Vital 4, for example, they provide us with 21 items, including sterile cotton ball, sterile finger dressing, sterile gauze pad, and also surgical tape. And they also provide us with the guidebook, such as general user guide, first aid guide booklet, and basic life support card. So the items or the checklist for first aid kit are depend on situation, place, and also company that market the first aid kit.
People often don't consider the importance of basic first aid education. So there are 4 reasons why first aid knowledge is important. The first one is helps to save lives. A trained person is more reliable, confident, and in control of themselves when an emergency arises. People who are trained are more likely to take immediate action in an emergency situation. Second reason is it allows the rescuer to provide the victim comfort. Being calm and assessing the situation helps the patient relax while their injuries are being treated and stabilized until emergency personnel arrives. The next reason is it gives you tools to prevent the situation from becoming worse. By being able to provide basic care, you can stabilize a patient until emergency medical services arrive. You will learn how to use basic household items as tools if a first kit is not available, meaning that you will be able to cope with many situations. Lastly, it creates the confidence to care. By taking first aid training, it helps you to reflect on yourself and how you and others react in certain situations. Having this understanding will boost your confidence in a wide range of non-medical day-to-day situations.
There are several ways on how to increase public awareness and knowledge about basic first aid. First and foremost, the government or the NGOs can provide basic first aid program for the public to train them on how to treat injuries before getting a proper treatment. Next, at the educational level, the teachers can treat the students on how to give basic first aid for the injuries that they see in their real life. And lastly, the mass media can display broadcasts on the right way to give basic first aid through television, radios, and the internet.
I will show you how to treat burn because hot water sprays on my brother's hand. First, take the long sleeve up and take off all the accessories. Second, allow the water on the burn area for 15 to 20 minutes.
This is the third step. You need to have a triangular bandage. First, you need to put the injured hand on the bandage like this and put this corner into his hand and make sure this up and down are same, and take the right to the left and left to the right, and you will tie it. Go down his hand and one, two, and the balance you put it under the tie. Okay.
Are you choking? Spit out. If they are coughing, encourage them to continue as they may be able to remove the obstruction. If they are unable to speak or cough, then they need your help straight away. If coughing doesn't work, slap it out. Support their upper body with one hand and help them to bend forward. Use the heel of your other hand to give up to 5 sharp back blows between their shoulder blades. If back blows don't work, then giving up with 5 abdominal thrusts. To give abdominal thrust, you must stand behind him, put your arm around him, and lean your hand between tummy button and bottom of their chest. Clench your lower hand in a fist, grab your fist with your other hand and pull sharply inward and upward. Repeat up to 5 times. If they still choking, call 999 for emergency help.
In this video, I will demonstrate the procedure treatment for helping someone who has been injured due to electric shock. The first step is to not touch someone who is still in contact with the source of electricity. The second step is to turn off the flow of electricity if possible. If you can't, then try to separate the person from the electric current using non-conducive objects. Examples of other non-conducive objects are wooden broom or plastic broom or even doormat. The third step is to call 999 or other local emergency services if the person has come into contact with high voltage electricity such as power lines. The fourth and final step is to check the person's breathing and pulse. If necessary, start CPR until the emergency help arrives. That is all from me. Thank you.
So these are first aid treatment for nose bleeding, or in medical terms they call as epistaxis. First, we need to sit on a chair and lean our head forward like this. We sit on a chair and lean our head forward. Most people tend to tilt their head back, but that is the wrong way to take. Second, we need to pinch our nose with our thumb and index finger like this, around 5 to 10 minutes to control the bleeding. And the last part is we need to compress area around our nose with cold compressor. For example, we can put some ice on clothes and then we compress around our nose.
If someone's feeling pain, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulders or a chair if available to hold blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask people to move away, and if you are inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again quickly, open their airway, check their breathing and prepare to treat someone who is unresponsive.
So these are the ways on how to provide basic first aid for stings. So for bee stings, firstly you need to remove the stings using a tweezer. And then you need to wash the wound area using clean water, or you can use antiseptic. And then you need to dry the wet area of the wound using a clean cloth starting from the wound area to the outer part. And then you need to apply calamine lotion if necessary to relieve the itching. Next, you can apply cold compresses or ice to relieve the pain. And then you can send the victim to the hospital to get a proper treatment.